Asthma and allergy occurs as a result of derailment in our immunity. It can be a localized reaction like a sneezing, nasal block, asthma, itching, or a generalized reaction involving the blood vessels with a fall in blood pressure, as in anaphylaxis. Skin and mucous membrane are not commonly affected as there is a high concentration of immune cells close to these natural barriers or the boundaries of the body. Human body considers anything other than a nutrient and any nutrient in excess quantity as a toxin. When any substance comes in contact with our skin, mucous membrane, tissue or cell, the immune system will screen it and, if not needed for the nutrition, mark it as toxic or foreign and invite measures to dispose it of. In the recent past, there has been an increase in the incidence of allergic disorders, including asthma, in all age groups, especially in children. Why? Globalization and improvement in transport gave us access to so many food crops grown in different parts of the world. The Green Revolution has changed the nature and chemical composition of many food crops and increased the pesticide and weedicide residues in food and drinking water. Processing and adding taste enhancers to food to make it tasty, attractive, and increase the shelf life exposes our intestinal mucosa to many more chemicals which are absorbed into our blood and reaching each cell of our body. Factories and vehicle fumes pollute the air we breathe. Use of pharmaceutical drugs as medication are also on in rise, which also contribute to the increase in the allergic disorders. Use of antibiotics and preservatives in food and medication make changes in the gut microbial flora, which play a major role in modulating our immune system. Perfumes and air fresheners aggravate the workload of respiratory mucosa-related immune system. Cosmetics and body care products and the chemicals on clothes, footwear, etc. also increases the stress on the immune system. All these factors increases the workload of the immune system and can contribute to the development of asthma and allergy. Our immune system acts through two major pathways. One is pro-inflammation or defense activity mediated through omega-6 and essential fat. Second is anti-inflammation or repair and healing mediated through omega-3 fat. Human body has evolved genetically to function optimally when omega-3 and 6 fat are in the equal proportion. But in our modern diet, omega-6 fat is too high and omega-3 is too low. This changes the ratio of omega-6 and 3 fat in the cell level, promoting inflammation, leading to inflammatory diseases including asthma and allergy. Excess fat accumulation in the body as overweight and obesity due to sedentary life and high-calorie food further increases the inflammation, and the intensity is more if the excess fat is in the form of omega-6 and trans fat. How cell activation program helps to overcome allergic disorders? In cell activation treatment for asthma and allergy, with the help of optimized nutrient food, drink, oil, and skincare, help to balance the inflammatory and anti-inflammatory activities of the immune system by correcting the omega-3 to 6 fat balance. With the help of optimized nutrient composition, we can reduce the number of substances that enter our body through food, medications, cosmetics, and body care. This reduces the workload and stress of the immune system and helps the immune system related tissue to have rest and regain health. Optimized nutrient food and the body care is free from any added color, preservatives, or other additives and help to reduce the allergen exposure and stress on the immune system while ensuring nutrients at optimal proportion to repair and regeneration of the damaged cells. Optimized nutrient food has high omega-3 content and helps to regain balance of the immune system. Oxyflex is a gentle activity pattern, helps to burn out the excess omega-6 fat in the adipose tissue. Before starting care, blood is tested to find out the allergens and extent of the allergy by checking the IgE and other allergy markers. While on cell activation support, it is easy to identify the allergens which are not identified by the blood test or the skin test. CAP is basically a lifestyle correction program, and those patients on medication for lifestyle diseases like diabetes, hypertension, arthritis, heart disease, etc. can reduce or stop medication. Many medications used to treat such diseases act as an allergen, and stopping such medications will help to recover from allergies. Most of the allergy and asthma patients depends on anti-inflammatory steroid hormones for symptomatic relief. Steroid hormone promote fat accumulation, weight gain, and reduce bone mass, making the patient prone for obesity and fractures. Most of the anti-allergic medications work by blocking the omega-6 mediated pro-inflammatory pathway. In cell activation treatment, by modulating diet and activity, we reduce the pro-inflammatory omega-6 fat in the body at cell level and increase the omega-3 fat, the natural anti-inflammatory pathway of the body, through nutrition and physical activity. With the cell activation treatment, we can taper off the steroids and other allergic medications gradually with the clinical improvement.